Division 3 was the production of shells containing biological agents stationed in carbon. This was a lot like Division 2, except this is more of a long-term thing. They would do the same thing they did to spread the germs, but these often took longer to kill, and they killed more people because it was spread a lot faster. Division 4 was the production of miscellaneous agents. That means everything from diseases to, it would kill you, it would just get you sick. You could lose different parts of your body just because of this. Division 5 was training of the personnel. Personnel was the surgeons, basically. They had a lot of surgeons that would do different things. They experimented a lot on pregnant women and children. They would impregnate the women that are held, the prisoners there, and they would often kill the baby and the mother. Unit 6 through 8 was equipment, medical, and administrative units. These units were more for the people that were helping keep Unit 731 together. Dr. Sharo Ishii made a lot of discoveries during this and about what diseases affect which parts of the body, but they also killed a lot of people. There weren't, as far as I could find, there were no survivors. There were probably about 1 in every 1,000 people survived. So, not a lot of people. They were prisoners from the war that were kept there and sent to Unit 731, and lots of civilians that should not have had any part in this. Dr. Sharo Ishii killed anybody that remained when they had learned of somebody coming to destroy the unit. When they learned of this, he ordered everyone that was still alive to be killed. They did. He was prosecuted, but he was not killed. He made a deal with the U.S. in exchange for information. That is 731.
Right quick, I'm going to explain to you guys another way they took people. You guys are all in one town. You guys live in the same house. You live in the same house. You live in the same house. You guys live in the same house.
And you're alone.
And you're by yourself. All right.
Makes
Middle
sense.
of the night. I'm part of Unit 730. What I want to do is I'm going to come in. I'm going to take you. You're coming. I'm taking you. I'm going to take you, Kaylin, and Avery. You guys go.
What about me? Do I live?
You're a homeless person.
I have nothing to lose.
All right. You guys
Are now in.
are infected. You guys are dead. Sorry. You can just stay up there.
I'll sit back down.
All right. Now we're gonna take 2 people from each house. You two, Keisha, Aaron. You two. You guys. You two, and you two.
What kind of game is this? Everybody's dying.
All right. You guys are dead.
I am.
Stay up there. That's how they infect people. Next. Here's what we're gonna do now. We don't want to. We have at least another 1,000 people, or not 1,000, 200 people in the neighborhood. So what we're gonna do is we're gonna send a bomb down. You guys are infected. You guys are gonna look for help. We say we can help you. So you guys go ahead and head on up there.
So you will all now part of Unit 731. You are where they will actually keep prisoners.
What if you can run fast?
So everybody who just joined up here, you each are going to be used for a different experiment. Well, were there any girls that came up? Carrie?
Paige.
So Carrie and Paige are pregnant now. You're both pregnant. Carrie, after you were pregnant, they decided to look at the stages of the baby. So your baby's now dead, and you died during surgery.
I was gonna name him Georgia.
infect your baby with the disease. So your baby did not survive, and your baby's dead, but you still are alive, and they sent you off for the prison for a while. So you're still there. Matt, they wanted to see how the kidney worked, a lot like with Joseph McNally. So they took your kidney out, no anesthesia, and they took your kidney out, they infected it with a disease, they put it back in, and left you to sit for a while. You came up? Okay, so now they're going to take your arm. No anesthesia. So they've taken that arm off, and they've also taken your opposite leg off. Now they switched it around, and you have a leg on where your arm was, and an arm where your leg was. Unfortunately, you didn't survive very long due to blood loss, and you were dead.
Alright, so you guys now see how quick it was. This is only for a couple years.
Yeah,
and they've
that
killed
was about 2 years.
200,000 people, and they did experiments on even more people that were sent somewhere else, or they even healed from them.
Wait, one.
The only way they know is because of the physicians that survived, that were allowed to tell the story.
And anybody who is still alive right now, you probably got a disease and died, or as soon as they found out that people were coming to destroy the unit, you were all shot.
Thank you all for your cooperation.
Wait,
Unit 731 was also known as the Asian Auschwitz.
what year was this?
Unit 731 was also known as the Asian Auschwitz. So just take pictures from Auschwitz that I showed you earlier. Put that into effect for this.
Okay, so we have a picture up. This one isn't squeamish or anything. You can read it if you, okay, just kidding. That's the other one. So these are the surgeons, and you can't really tell what they're holding, but they have different, they have, I'm pretty sure with the story that went with it, it was, those two, I believe they were looking at different intestines and what the effects of one of the diseases they injected were, and he is looking at another injection to inject into something else. So they are studying that. The next one is more of a reading one. You don't have to read it, but it's basically talking about how it came into play in 1935, and it was a lot of biological weapon research to use in the war. It was during World War II. It talks about how, down here you have it says at least 3,000 anti-Japanese and anti-Manchu fighters from home and abroad, and innocent civilians were maimed and killed as vivisection subjects, which is surgeries without anesthesia.
My person, his name is J. Marion Sims. He's the father of modern gynecology, which is like women's studies. He experimented on African slaves to find a cure for vesicovaginal fistula, or VVF. Some were experimented on up to 30 times because, well, they don't have much of a say whether you experiment on them or not, because they can just be like bought and sold. And VVF is an abnormal fistulous tract extending from the bladder to the vagina, which involuntarily causes urine to flow into the vagina. Okay. He rarely used anesthesia during his operations because they're not painful enough to justify their trouble and risk of administration. But keep in mind, during this time, it was just being introduced, so they weren't really sure how to use it as well as they do now. And although his methods are considered controversial at times, his experiments have benefited many women and made tremendous breakthroughs in curing a bothersome medical condition. Yeah.
Alright, so guys, you guys are okay on this one, so you can just not say anything. Girls?
That's great.
Oh. I'm not gonna go into that. I'm not gonna go into that in depth. I'm not gonna do anything to you guys. Basically, this guy, you guys are all slaves. He owns you. So guys, you're always out working. You never get a break. He's experimenting on all you people. Okay, so now we're in the future. Same thing applies. if this wasn't for this guy, you probably wouldn't be feeling the same way that you are right now. Is what I'm trying to say. So you can basically thank this guy for how you feel right now.
Basically being comfortable.
I'll tell you later.
Girls.
I mean, that's the easiest way I can say it, so I don't know.
Okay, the second one is electroconvulsive therapy. It's basically the use of electrical currents, like they hook these things up to your brain, and it shocks you to induce seizures to help cure mental illnesses, like say like you're depressed or suicidal or something. You're put under anesthesia when you're first receiving it, and it's a generally safe method in the modern day. It used to not be as safe because when they were like first experimenting on people, they didn't know like the dosage of electricity to give to someone. So it's basically trial and error on the doctor's part. Most patients that go through ECT experience some sort of memory loss or other symptoms such as nausea, confusion, and headache. Some people are confused up to 2 hours after the procedure is done. Memory problems usually improve after a couple of months, but some memories never return, like mostly just once like close to the surgery. Well, not surgery, but operation. And there's controversy surrounding the method between the effectiveness versus the side effects because it's not like it's like one of the last resorts to use to treat depression or mental illnesses. So, because there's not as much known on it.
Alright, guys, I'm going to use you guys on this one. Girls, you're out of this. Alright, this table, you have a mental illness. We'll say you're schizophrenic.
That's like how they like put it on you.
You're depressed. You guys are depressed. You two, well, more like you, is suicidal.
Oh, great.
You three, you're dyslexic.
Are you trying to say something?
And then you two,